Why did it take so long to invoke the Defense Production
Well, you know,
Act?
hospitals are supposed to have ventilators, too. And when we have thousands of ventilators, it sounds like a lot, but this is a very unforeseen thing. Nobody ever thought of these numbers.
But we knew for weeks we needed more ventilators. So why did it take so long?
Well, we knew. It depends. It depends on how it goes. Worst case, absolutely. Best case, not at all. So we're going to have to see where it goes. But we are ordering thousands and thousands of ventilators.
Hospitals are supposed to have ventilators, too. Joining us now, Morning Joe Chief Medical Correspondent Dr. Dave Campbell and Dr. Vanessa Kerry, the CEO of Seed Global Health, a nonprofit that helps train future doctors and nurses in countries with limited health care resources. Great to have you both on the show this morning.
Vanessa, you've heard reports, doctors being told to actually tear off parts of their gown. You use it as a makeshift mask to bring bandanas from home. Could you ever imagine that this would be happening in the United States of America at one of our most trying times?
No, I couldn't at all. And I think that the reality is that we're facing an existential threat that we have not experienced in generations, and arguably that we have never experienced because of globalization, the size of our population in the world. But the truth is, this is really a crisis of several proportions. One, the fear that we are going to get sick. It is a crisis of the preparedness that we have here. It is an economic crisis. It's an information and misinformation crisis, but it's most fundamentally a crisis of leadership. And that, I think, is what people are feeling the most and what is fomenting so much of the panic, including among my colleagues at Mass General Hospital and elsewhere who are going to be on the front lines.
Dave,
and that crisis is at the level of our administration.
Yeah, Dr. Dave, I want to be very careful here. I'm not going to mention any names, but we had a conversation last night. You have a colleague that you've known for 3 decades now, extremely respected professional, who got a call from one of his colleagues in Italy asking for any help in getting ventilators over to Italy. He placed a call to somebody that he knew who worked for a company that mass-produced ventilators, and that company had been told, I guess in early February, that they were going to be sending all of their orders to China, and that a whole mass collection of ventilators that the Chinese government had called up and said, we'll buy all of your ventilators through June. Without revealing any of these names, because we're working the story right now, tell us about that, and tell us what you learned by talking to the person involved in this about just how difficult it is to mass produce ventilators and why you are now so skeptical of the government's claims.
Thanks, Joe. This is a story of China being first to the plate in the development and need for ventilators. So in mid-February, this company received an order for 1,000 ventilators from China. They had 20 to 30 in stock. They supplied those. The order then went in to manufacture 100 ventilators per week over the next 10 weeks. That's 1,000 ventilators. If you were to call this major company today and asked to order ventilators for a company or hospital or medical center in the United States or Italy, which is what happened, there's no supply until June. So it's not a condemnation of China asking for these ventilators. They needed them. They need them now. They just needed them 2 months before the United States and Italy. Joe.
Yeah, and Mika, this company is a major multinational corporation and one of the best-known American companies that there are. But again, they're not going to be producing ventilators for the United States and for American patients through June, they're going to be working in effect for China.
And as we flesh out this story, we'll see just how complicated it is. It's not just, you don't just deliver ventilators and make them. They have parts. Their parts need to be replaced constantly. This is a crisis that could have been slightly averted, and instead we are caught flat-footed. It's going to be the next big miss. First was testing, which we still don't have. The second is going to be hospital space, supplies, ventilators, and masks. And it's why everybody's uncertain, especially the markets. Dr. Kerry, Seed Global Health sends doctors into third world areas to train people in those third world countries to try and deliver their own health care. Do you envision medical students at this point being mobilized? Because we have a healthcare workforce that right now is blatantly being exposed to the coronavirus.
I think this is what's really complicated, is that we're asking healthcare workers, like my colleagues, myself soon, when I have to go to the hospital, that we're going to be working in a situation where we don't have the protective equipment we need. And I think that that's going to be a real problem, because what's going to happen is, as we get infected and we get pulled from the healthcare workforce, you probably won't see medical students, but you will see potentially your dermatologist. A colleague of mine who is a dermatologist recently said, I feel like I need to brush up on my pulmonary and critical care. Where do I go to look at it? And I think that that's the reality of what we're going to see, unless we take some unprecedented actions and we embrace it as a community, as a country, that if we can buckle down and rise to this moment, we can help mitigate how long we have to live in that reality. We are going to be in this for a while. We have to accept that. But for how long is up to our actions today, and ideally the actions of this administration to make testing rapid, much more widely available. They held a press conference a week ago saying that we were going to be scaling up tests immediately. We still don't have those. It takes 2 days still, at least, to turn around a test. We have over 8,000 cases in America, over 150 deaths now, almost 9,000 cases and 150 deaths. And we are still testing at about, I think it's something like 500 Americans for every million people. South Korea was testing, at 5,000 for every million. It's just, we will not get control without more information and without better leadership to guide us.
Dr. Kerry, it's Willie Geist. We can't give thanks big enough to you and all of your colleagues in the healthcare worker community for what you're doing right now on the front lines. I know you're about to go in yourself. In terms of equipment, in terms of things you need, gloves, masks, respirators, ventilators, I guess the question for a lot of Americans is, why don't we have enough of those things? I understand that this is a huge ask, that the Pentagon can release what it can release, but a lot of those reserves are for something targeted, a big event in New York City, and they suddenly need 1,000 ventilators there, not for every hospital across the country. So what can happen as of this morning? What could the federal government do as of this morning to get at least the gloves and the masks and that protective equipment that you need into your hands so you can get to work?
Well, there's a couple things. I think releasing the supplies is going to be critically important, but that's a stopgap, right? We are going to need millions of masks, millions of gloves, and what we have just been released is only going to get a fraction of us there. It might buy us a little bit of time. But the reality is we never thought that we could be vulnerable to a pandemic of this size. With the work that I do with Seed Global Health has always believed that health security is national security, and it's critically important to invest in health systems around the world because we're only as strong as our weakest link. We never thought that we could be that weakest link. But the reality is that now that we're there, what we have to do is to scale up production. And also, some of my colleagues, who are some of the most foremost public health professionals, have identified massive sources of masks and PPE available in China now, as they have finally reported no cases as of yesterday. For the first time, no new cases that are available. But we have trade, tariffs and bans that are in place that aren't making it possible for that equipment to be available. That is irresponsible in this moment of crisis right now. We need to be creative. We need to be bold. And I think that I'm very hopeful that we can get ourselves there sooner rather than later, so that we're not dealing with this for, into years, that we're dealing with this hopefully only into the summer and in a place where we can start to catch our breath a little bit before we potentially get a second wave in the fall. This is here to stay, though. The question is how bad and for how long.
So, Dr. Dave, this is here to stay, that's for sure. I'm hearing everything from different waves of this to shutdowns becoming a part of life for several years. We don't know what's to come, but this is clearly here, and the numbers are beginning to double in certain localities as we get testing. The president has deployed 2 Navy wartime ships to service hospitals, but the understanding is that that will take other patients that can't fit into hospitals anymore due to the influx of coronavirus patients, and they won't be ready for a few weeks. And then there's the act that he passed that allows him to direct industry to produce critical equipment to confront this crisis. None of this seems like it's happening right now. It still feels like we're weeks, potentially months off from being up to speed in confronting this crisis.
Yes, Mika. There are a few solutions, none of them very good, but one Dr. Kerry mentioned is to scale up production. Scaling up production of ventilators in the United States can happen, but every ventilator used in every hospital in this country is under the FDA regulation. Nobody manufactures and uses a ventilator here that's not tightly regulated by the FDA. Special exemptions to allow some of the older ventilators that are still safe to be utilized or manufactured may help. And also, we heard that there are 10,000, there's a massive stockpile of ventilators and equipment. That is perhaps more a virtual stockpile. My sources tell me that there is not a single warehouse somewhere with 10,000 ventilators. They're spread out over storage rooms and places in hospitals, many of them older. So we really have to look closely at how to expand and scale up the use of existing safe ventilators, the manufacture and collection of safe ventilators from wherever they are, to see if we can catch up. We have about 2 weeks. We have some time. But beyond that, and Dr. Kerry may agree, beyond 2 weeks, we really don't know where this country will be.
What I also want to add, though, is we need people who know. We need people who know how to use those ventilators too, and that's the second piece of this.
And that's the layer of educating doctors, maybe young doctor, medical assistants, because we're going to lose people at the rate we're going. The numbers are doubling every few days. Dr. Dave Campbell and Dr. Vanessa Kerry, thank you both. And coming up, a sea change for Republicans who once opposed bailouts. The Washington Post's Bob Costa joins us with what he calls President Trump's $1 trillion gamble for re-election.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.